A major study out this morning finds that women who have as few as 3 alcoholic drinks a week have an increased risk for breast cancer.
That same study also found the more you drink, the higher your risk. Dr. Holly Phillips is here with more on these findings. Holly, good morning. So we've heard about, we hear all kinds of different studies about alcohol, the risk versus the benefit. We've heard about a possible link between drinking and breast cancer before. What's different this time around?
Well, you know what? What's majorly different about this study is that it's a big study, which makes it more powerful. It makes the results more important to us. Specifically, the study looked at 100,000 women over the course of 30 years. What the researchers found is that women who drank between 3 and 6 alcoholic drinks a week had a 15% increased risk of getting breast cancer. Women who drank 2 drinks or more per day had a 51% increased risk.
And this is any kind of alcohol,
yes,
right?
Yes, exactly.
Wine, beer.
This is any wine, beer, or hard alcohol. And also, the younger you started drinking, the greater your risk, even if you stopped when you turned 40.
Well, quite simply, what's the connection between alcohol and breast cancer?
Well, this study didn't look at it in particular. However, it probably has to do with the hormone estrogen. Estrogen fuels most breast cancers, and alcohol is thought to increase your circulating blood levels of estrogen, and that may be the link.
So based on these findings that you said, which we're looking at now, should women stop consuming alcohol altogether?
Right. Well, Erica, it's still kind of confusing, frankly. Doctors aren't sure what advice we should be giving, but here's what I'm going to tell my patients. If you don't drink, don't start. If you drink 1 drink a day and you're not considered to be in a high-risk group for breast cancer, you can continue to do that until the American Cancer Society changes their recommendations.
That's their recommendation now, is
exactly.
1 a day.
If you drink 2 or more a day, you need to cut back. That's really where I'm going to go with my patients until we have more information.
These studies, it seems to be confusing. I think a lot of people would say it seems like there's a different study every week. Red wine's good, this is good, that's not good. Alcohol aside, because like we said, we're going to hear more of these studies, I'm sure, over the coming months and years. What are some other ways people can reduce their risk for breast cancer? Right.
Still, overall, it does seem that alcohol is a small part of our overall breast cancer risk. Things that are much bigger really have to do with our sort of lifestyle, our healthy habits. Number 1, we need to control our weight. Being overweight, especially after menopause, really increases your breast cancer risk. We need to follow a healthy diet, meaning plant-based, and finally, exercise. 30 minutes, 5 times a week is shown to make a difference. Those things are much more important in fighting breast cancer.
All right, Dr. Holly Phillips, thank you.
Sure.